Richmond plastic surgeons, and I'm here to discuss with one of my patients, Ms. Doherty, about breast reconstruction. Ms. Doherty had a left breast reconstruction done with implants in the past, and she had radiation to that breast. She had multiple problems afterward, including a firm capsule around it called capsular contraction, a Baker 4 medically. What this is a hard raised implant, which is one of the most common complications of breast implants for reconstruction. She then underwent a deep inferior epigastric perforator breast flap, or a DIEP flap, which is used in your own tissue. And I want her to discuss today a little bit about the difference between using her own tissue and an implant in terms of breast reconstruction, to help people who are trying to decide which way they should go in terms of breast reconstruction. So Ms. Doherty, tell us a little bit about your journey so far through breast reconstruction.
Well, to begin with, I had breast cancer, and I had my left breast removed. The doctor put in an implant in it, and she explained to me that she could have done the DIEP flap, but at the time she would have had to gone through she had had to use the muscle, which would not have worked well at all for me, and so I chose the implant. But going through the rest of the breast surgeries and then onto radiation, after that it encapsulated, and it became harder and harder and painful, and it was something I could hardly stand. And going back to that same doctor, she explained to me that there was a doctor here in Richmond that was one of the only groups that did another procedure, which would actually use my own tissue. And I could decide after talking to the doctor if I wanted to do that. Well, I came in and had a very lengthy conversation, which impressed me quite a bit, because he took a lot of time explaining what was going to happen, and I listened, and right away I knew this is something I needed to do, because the breast was getting worse and worse, and I've been through so much, and I thought, this is what I've got to do. And he made the appointment, we set up the time, and I had the implant removed, my own tissue put in from my stomach. And I must say, I expected a lot of pain and a lot of horrible recovery, which didn't happen. I couldn't believe it. I used pain pills, but I didn't use as many pain pills as was given me. There just seemed to be no pain. I mean, right at the beginning there was, but then as time went by, it got better and better. The breast became better. It became more like my breast. It is, and this is, I had it done December the 5th, 2013. It is now February, and it feels like my own breast. I'm very happy, and you know, at 77, I'm still a young lady, young woman, and this was the answer. And anyone who's thinking about whether they want to do an implant or use their own tissue, but they have to use their own tissue the way that this doctor did, Dr. Stanwix, because the other way I don't think would have worked out fine. I have no problem with my stomach. I'm doing physical therapy. It's just amazing. And I have told everyone, all of my family, after going through this, that he must be the very best doctor.
Well,
because I didn't have any pain. I said, this is just amazing. It is amazing. And after going through all of the chemo and the radiation and nothing.
Well, that's a great story, Ms. Doherty. And I think one important thing is that what she was trying to say is that she is deciding, that she was told that she may need a tram flap, which is different than the DIEP flap, which I do. The tram flap takes the muscle and the skin and fat, whereas the DIEP flap, which is what I perform, only takes the skin and the fat, avoiding hurting the muscle and being able to save all the different types of strength of your core. And that's one important thing about the DIEP flap, and that's why she looks as good as she does today, not only because she's healthy, but also because we didn't have to take her muscle. And that's an important thing to distinguish too. And when it comes to using your own tissue versus an implant, that's an important discussion. I think she did a great job of describing the differences between the two and how much more natural it is using your own tissue, and that for those that are scared about using their belly, that that this doesn't involve taking the muscle, and that the pain afterward is minimal and is easily recoverable. So for that, I thank you, and
You're
those
welcome.
are very kind words. And
Well, it's the truth. I've been doing stomach exercises now, and I was told that you would not have any strength in your stomach. In fact, I've talked to people that had it the other way, and I'm not experiencing that. I'm actually holding my stomach in. When I go to physical therapy, we're working with my stomach muscles, and what can I say? I'm very pleased.
You're
Thank
welcome.
you.
I appreciate your time today. Thank you.